Hi guys, this is Dr. Keyur Butch, consultant knee, shoulder and hand surgeon uh, from the UK, India and USA. These are my three countries where I've trained and worked. Majority of the time in England, about 20 plus years. But today I'm going to talk about something that you may have thought about but may not have felt like asking because you're worried that by asking this question to your surgeon, you might come across as if you're doubting him. And the topic is very, very important. It's a topic of avoidable or unnecessary operations. Now, there was a survey done in India that showed that 44% of operations may be unnecessary. And similar findings have been there from the USA, where billions, with a big B, billions of dollars have been wasted on unnecessary operations with unnecessary and avoidable complications. Similar findings were observed in the UK, and as one of my colleagues from China told me at a conference in Istanbul not so long ago, that China too has a problem of unnecessary operations. So why do surgeons perform, or the hospitals allow the surgeons to perform unnecessary operations? It's not as simple as because they all want to make money. It could be because surgeons are basically trained to operate and they might feel lacking if they're not operating enough as they think, or they might not know any better because they've not seen anything better, or the surgeon wants to become famous by having several patients that they've operated and they can show their success. And in many countries where there is no proper audit, independent audit of surgeons, for surgeons, it is very easy to show their success and hide their failures at the same time. So this fame bug can make surgeons do unnecessary operations. And lastly, of course, there is financial consideration in many cases, both from the surgeons and from the hospitals. But all this can cause harm to the patients, to the insurance companies, and to the governments who are supporting any healthcare schemes. So, in my field of orthopedics and trauma surgery and joint replacement, I've seen many operations done for fractures which are unnecessary. For example, the upper humerus fracture, or the fracture near the top end of the arm bone near the shoulder. In many cases, in almost majority of the cases, does not require operation and heals in good time with good function without surgery. So there you go. Then knee replacement. In allopathy, there are 11 different treatments for knee arthritis and knee pain. Only 2 of the 11 are knee replacements: total knee replacement or partial or unicondylar knee replacement. So I can say that out of 10 knee pain patients that I see in my OPD, 8 of them are treated without any type of knee replacement, and they're quite happy and reassured about it. But those 2 who need them, I tell them very clearly why they need it. So how do you find out whether you are having a necessary and unavoidable operation, or whether you are likely to have an unnecessary operation? How do you find it out? You have to ask this question to your surgeon. So please listen to this question very carefully. You should ask your surgeon that, can you please explain to me and share with me the current best evidence for treatment of this fracture, or of this ligament injury, or of my knee arthritis, or of my thumb pain, or of my carpal tunnel syndrome, or whatever it is that you are likely to have surgery for. Ask your surgeon to share with you not just their opinion, not just their experience, but current best and credible global standard evidence. You deserve that. That's the basis on which I treat my orthopedic patients who come to me mainly with knee, shoulder and hand problems, whether after fractures, whether after sports injury, whether with knee or shoulder arthritis, whether with thumb pain and arthritis. And this helps me avoid unnecessary and avoidable complications too. It saves my patients money and they are happier. So in the long term, it is good for the hospital and for the reputation of the healthcare industry, and for the hospital's reputation and the surgeon's individual reputation too. So, if you are in for an operation and if you want a second opinion, then feel free to contact me, Dr. Kayur Butch, MS Orthopedics, MCH Orth UK, FRCS Edinburgh, FRCS Trauma and Orthopedics UK, here at SIMS Hospital in Ahmedabad, where I'm based. And you can call me or SMS me on 0091 991 33 So have happy time and stay mobile, stay fit, stay active. And of course, if you need an operation and once it is established, then don't have any hesitation or doubt, but make sure that it is evidence based and done by an ethical, kind surgeon. Happy healing.